Hello, everyone, and welcome to Module 3, Introduction to Nursing and Basic Nursing Skills. Here are our objectives. There's 2 slides with our objectives on it, and you also have this in your modules in the Canvas shell. Well, let's get started. How do you define professionalism? How do you define it? I define professionalism as being a leader, my attire, dressed professional, the way I speak to others, the way others perceive me, the way I hold my nursing profession up, my guidance with American Nurse Association by the BRN. I define my profession in that way and a little bit more. My definition and my personal definition of professionalism is serving those who are in greater need and who are just in need in a professional way, meaning respecting them at all times. This is what Cozier and Erb says. A set of attributes, a way of life that implies responsibility and commitment. This is your responsibility and your commitment. Now we are servers to the community. Did you know back in time, nurses were people who committed crimes and they were prostitutes? It wasn't organized training. There was really no education. They basically, in quotes, said real women stayed at home and learned how to be a pleasant companion to the husband. So we know that is definitely different in today's time. We serve our community. We're very well educated. As you guys know, all the prep it took you just to get to this program, and I'm sure some of you will move, or all of you will move forward with your education. We are not criminals. We have changed that. We are professionals. In nursing, we have several roles. We have roles as a caregiver, as a communicator. We have different roles that we perform. We're teachers. We're patient advocates. We're leaders. We're managers. We're counselors. We're even change agents. So I want you to look at the following slides and the bullet points and see how they pertain to you in your life and how you can convert yourself over to a professional and attend to some of our roles, or not some, all of the roles as a healthcare provider. So here's a slide regarding a caregiver, and I'm sure you read that already while I was talking. What about communicator? So we got to make sure that we're clear with our family members, our patients, even our coworkers. So make sure we're given a clear communication that the other person on the other end understands what we're saying. You may want to repeat, paraphrase what you're saying, paraphrase what the patient is saying. So I hear you saying, or I hear that you said X, Y, and Z. So you do active listening as a communicator, and then you repeat back what you felt you heard so the patient or the healthcare professional knows the message is clear, not like I think he said, I think he or she wanted me to do X, Y, and Z. If you paraphrase it and respond back right there in time, you can get rid of any discrepancies of miscommunication. Here's teacher. So, of course, we educate our families and our patients at the bedside. Always. We are always educating. And that's what we will be doing throughout this program and throughout your profession. And most importantly, we are patient advocates. If you see something that you feel like, hey, this needs to be done for this patient, this is not being done for this patient, speak up, be their voice. We know the system more than they do, and we know what's available to them. So let's be an advocate for them so they can mainly stay at the hospital, be home in their nice environment, and not be in a hospital where they're at risk for infections, falls, injuries, and so forth. And of course, we're leaders. So you're a leader at this moment. So remember, Dr. Z was telling everyone, your family is now looking up to you. You have stepped into a leadership role. So in that leadership role requires professionalism, being ethical, all of those things, and more. So you are our new leaders. And of course, we manage care. So when we manage care, hey, case manager, X, Y, and Z is going on. She may need a bedside commode or a hospital bed. Hey, social worker, patient is having some psychosocial needs at home, having difficulty getting things taken care of at home, don't have a caregiver, having toileting needs, unable to cook at home, maybe some problems with the family. Hey, respiratory, this patient is short of breath, patient has an order for albuterol. Can you come and provide a albuterol treatment for our patient? So we manage the care. We're accountable for our patients. And as we said earlier, we are advocates. We are also listeners as counselors. So we process helping a patient recognize and cope with their stress. So we sit there and we listen and we try to give professional nursing advice. And if it's out of our scope of practice, as we manage care, we find those people who can assist us. And of course, we're a change agent. Change agents are not only, they help to modify in their own behavior, but it applies to patients as well as your coworkers and as well as the organization. What can we do to make things better? Now, how to look the part. I'm not going to speak on all of these. I will let you read them, but they all are very important. Let's talk just a little bit about Miss Florence Nightingale. She was the lady with the lamp, remember. You can read more about her in your book. She, hospital reformer, hey, this place needs to be clean. How can patients heal in a dirty environment? Okay, she also implemented health policies where there wasn't any. Remember way back when I said there was just, criminals and prostitutes who they would call them nurses. No, we have health policies, things that we do. Now what we do is based on evidence-based practice, best practice. She was the first nurse scientist. So notes on nursing, what it is and what it is not. So open Nightingale Training School way back in 1860. So there was a lot of things that were happening. Here's a quick picture of her. And let's keep going. I believe I touched on these things, but you can look at them also. Take a look at this slide about Florence Nightingale and how she wanted to keep our environment. And if you notice, we still have these problems. This is Miss Florence Nightingale. Also, I wanted to touch on how she wanted to keep the room, the air, even sewage and drinking water clean. If you haven't noticed, we still have problems in third world countries where they don't have clean water, not a clean environment. So we still are in need of help in our other countries. So let's be thankful for what we have, but know that there's others out there who definitely need our help. Clara Barton, she was a school teacher. She did establish the American Red Cross, if some of you was not aware of that. So we have nurses that are doing lots and have done lots of wonderful things. I want you to go in your chapter and read on Lillian Ward. She was the founder of Public Health. So, trained in New York, nursing services to the poor New York slums, different things that we do that others don't want to reach out and do. We've had our nursing champions, Lillian Ward, Nightingale, who done these things, as well as Mary Brickeridge. She's a pioneer nurse, established Frontier Nursing Service. Look at all the things that these folks are doing for us, have done for us. What about Margaret Higgins? She was a public health nurse, and some of you may want to be a public health nurse and after you graduate and get your public health license certificate also. She was the founder of Planned Parenthood. So we have nurses that are out there that people just are not aware of all the things that we have done. We have done wonderful things for the community. Look at our contemporary nursing practice and look at the factors that affect it. Economic, legislation, demography. I'm sorry, I said demography, but our population, the study of our population. So you will see as we continue on in nursing, we will continue to have things that's affecting or that influence our contemporary nursing practice. Also, contemporary nursing practice, it is a collective bargaining. Nurses dealing with concerns over issues on safe care. We are advocates in the Capitol building, asking for better safe care for patients and for the nurses. So we also are a field of cultural diversity. So we have to be aware of how we feel towards ourselves and how we feel towards others. Okay, technology, you guys all know it is not going away, it's advancing. So we have technology, we have to implement it in our nursing care, but the most important thing to remember is the patient is always first. There are about 4 slides on ADPI, which is ADPI is considered assessment, diagnosis, and planning, intervention, evaluation. We will continue assessing, diagnosis, planning, intervention, evaluation throughout our theory. I want you guys to look through all of these slides. If you have any questions, please bring them to class and the skills lab and during office hours so we can make sure you clearly understand what assessment is, diagnosis, planning, intervention, and evaluation. And of course, I will most definitely reinforce this, touch on this in every clinical and also in theory. And so will your clinical instructors as well. Okay? So we will always continue to touch on those. So caring, know what caring is. Okay? We do have another nurse theorist. Her name is Jean Watson. And Jean Watson's caring is grounding in a set of universal human values. Where I work, we support the caring theory for Jean Watson. I'm correct. Please remember there are 3 types of caring or methods of caring. So we have methods where we are, here, let me go over these 3 types of methods. You have tangible, emotional, informational, and discussion. So one is your collection. So we try our best to collect data. Data is our observation. And let me move forward. I'm sorry to get that. I had someone bother me for a second. So our psychomotor skills for data collection. So what we talked about a little bit in class, we do some observation, clinical signs of client distress, threats to the client's safety. We're looking at the IV pumps. We're doing all those things. We're also interviewing. So we're asking questions, asking closed, yes, no. You try not to do the yes, no questions. You want it to be more open-ended. Try to get more out of your patient. What is it that they can tell you? And so you can get more on how to treat this patient. Okay, so, and then we do our physical assessment, our head-to-toe assessment. We also have a discussion. So let's stop here for a second. So as this slide say, as you identify your patient's needs, only how we can do that is with a detailed assessment. See what's going on with our patients emotionally, physically, also, and spiritually. Now we do have isolation precautions that I want to go over, and I want you to review these slides so you can understand them. So when we talk about isolation precautions, it's used to prevent the spread of infections, standard precautions, transmission based. We need to know those. So hey, what about droplet? Nuclei, that's 5 microns. I'll let you read that. And this is considered our airborne precaution. Now as we move forward, we're going to talk about droplet. Now here is your slide on droplet, and look at the different things. Look, this patient needs to be in a private room. Okay? And we also going to talk about contact precautions. You guys went over your PPEs, and you know that it's a suspected illness. It's spread by direct contact. We see a lot of this one in the hospital, C. diff. So if you don't remember, you may want to copy these down so you can keep them. Okay? And here's our need for the gowns. And we did this in ATI. I just wanted to make sure that I went over these with you. I'm going to slide through the next 4 slides pretty quickly about delegation. Just want to make sure that you're aware that when we delegate, we must follow through. And so for fundamentals, we will not be delegating to anyone, but as we become registered nurses, we do delegate. But once we delegate, we're still responsible for that task, and we must follow through and making sure that it's done. And making sure that we delegate to the right healthcare professional.